Are you having difficulty falling asleep at night? Find yourself tossing and turning? Maybe you're sleepy and then you go to the bedroom and you're wide awake. You can't go to sleep. Well, welcome to the Insomnia Club. 30% of adults in the United States have problems with insomnia. I'm Dr. Hamilton Stubbs. I'm a double board certified sleep specialist, certified nutrition specialist, medical researcher, and the co author of medical textbook chapters, most of which focus on sleep or the neurology associated with sleep. If you haven't already subscribed to my channel, I hope you will. And don't forget to hit notifications so you'll know when I upload my next video and you won't miss a thing. So let's get into it. Insomnia. Insomnia is a very common sleep disorder, but it doesn't have to be primary. It can be secondary. It can be secondary to many things, including other sleep disorders. But some common medical conditions can also cause problems with insomnia. Things like diabetes, where the blood sugar is uncontrolled. Even if you have problems with asthma or other breathing problems, you can have, I need to get my water. You can have problems with staying asleep. If you have too much stress, or if you have endocrine problems, thyroid problems, heart disease, there are so many medical conditions that could cause insomnia that you should never settle for just getting a prescription sleeping pill. Make sure that a health provider is evaluating you to make sure that your insomnia is not secondary to an untreated or undiagnosed medical problem. Some of the most common sleep disorders that come in the form of insomnia or people present with insomnia include things like obstructive sleep apnea syndrome. This is where the breathing is either cut off completely or partially during sleep, and the person will have daytime and nighttime symptoms. The daytime symptoms predominate as feeling tired all the time, falling asleep very easily. Some people say they can fall asleep anywhere, anytime. You also get some mood changes, maybe a little bit more irritable than you were before you developed obstructive sleep apnea syndrome. The nighttime symptom is characterized by loud snoring, but you can also have frequent waking up at night, tossing and turning, sleeping in unusual positions, and getting up to go to the bathroom more than once during the night. Other sleep disorders that can cause insomnia include things like periodic limb movements. These are the involuntary jerk patterns that happen during night. And these jerking patterns are not something that you can mimic. The other common cause of insomnia that's a sleep disorder is restless leg syndrome. This is where when you lay down or you're at rest, you get an unusual sensation in the legs that just make you want to move your legs. So there's lots of reasons for you to make sure that you're not being just given a prescription pill. You want to make sure you don't have an underlying medical condition causing your insomnia, difficulty falling asleep, difficulty staying asleep, or waking up earlier in the morning than you want to and unable to return to sleep. Now, if you make it over to a sleep specialist and you don't have a diagnosed sleep disorder other than insomnia, then you may be prescribed a sleeping aid and cognitive behavioral therapy. Cognitive behavioral therapy has been shown to have a better sustainable rate of improvement over the long term compared to prescription medication. But if you aren't astute enough to look or ask a question about sugar, it could be that your problem with insomnia is simply due to eating too much added sugar. That's right, added sugar. In America, we eat way more sugar than is recommended by the American Heart Association and even by the US Department of Agriculture. Now, the US Department of Agriculture recommends that we limit sugar intake to 10% of our caloric intake. Well, that's kind of difficult to figure out. So I like to just go by the American Heart Association guidelines, which are a little easier. Their guidelines say that women shouldn't eat more than six teaspoons of sugar per day, and men 9. Isn't that easier? But how are you going to find that out? You have to read the labels. And when you're reading the labels, you'll be able to find it much easier since in 2020, the Food and Drug Administration mandated that all food manufactured in the US and packaged has to have a label in a certain order. And that order is you're going to have how many calories per serving, going to have your number of servings and your nutrients right in that third spot, like the middle or the lower part of that label. And on the other side, you'll see the daily percentage average. But what you want to focus on is the total carbohydrates. And within that section, which is the nutrient section, you can go down and find out the amount of fiber, and you can also find out the amount of added sugar. Focus on the added sugar first. That's the easiest thing to try to get a handle on. Well, it's not completely accurate because manufacturers have a way of adding adding sugar into the food and getting around the FDA requirement mandating that they label it. But we won't get into that right now. If you want to know more about finding hidden sugar, check the link below. I'm going to be teaching that in an upcoming course. So you'll get an idea of how much sugar you're eating if you're reading these labels and just write it down and find out, are you getting more than 6 teaspoons a day if you're a woman, 9 if you're a man, and 4 grams equal 1 teaspoon. So you shouldn't have more than about 25 grams in a day. They kind of round that out to make it a little easier for the math. When you add up how much added sugar you're having, if it's more than 25 grams in a day, your insomnia could be due to just having too much added sugar. Sugar is a sleep disruptor that many people don't talk about. And it's probably because we're just realizing the impact of the impact of sugar upon our sleep. So when you get too much sugar, it's going to decrease the amount of deep sleep that you're getting. So you get less deep sleep, and it fragments your dream sleep, and it gives you a poor quality to sleep, makes your sleep kind of choppy. So if you're having fragmented poor quality of sleep, you can have symptoms of sleep deprivation where even though you may have been in the bed for an adequate number of hours, you're not sleeping well or sleeping enough because you're waking up having symptoms of insomnia. And this creates sort of like a chicken and an egg thing because when you don't get enough sleep, you wake up tired and the fatigue makes you crave, guess what? Sugar. And so you want to get a hold of that. So the treatment wouldn't be to have a prescription pill, it would be to eat less sugar, which can be very challenging because sugar has addictive qualities. Even though it's not classified as an addictive substance, some people aren't able to easily stop eating sugar. Sugar will stimulate the reward system, and when it stimulates the reward system, it is causing us to crave additional sugar. There are ways you can stimulate the brain to boost your mood, elevate the mood, and elevate your happy hormones, serotonin and dopamine, and you won't need sugar. We can also rewire the brain, and this is done over time gradually. But in this video, I'm just giving you a heads up that you want to check your sugar consumption and then talk with your healthcare provider to see what happens and to follow you about decreasing that amount of sugar. I always recommend that you talk with your healthcare provider before you make any changes in your diet, because if you are placed on some medication, that medication may have been adjusted for the diet you were eating at the time the medication was prescribed. So always talk with your healthcare provider, even for something as small as cutting back on your sugar, especially if you're on medications. If you want to learn more about sugar and how sugar can impact your health, sign up for one of my classes. You can find them on my website, or I'll put a link below. And you can also download my guide, Sensual Eating: 6 Steps to Decrease Your Sugar Craving and Help You Stop Overeating. It's free. I'll put that link below. So remember, if you don't sleep well at night, there are a lot of causes for it, and you want to make sure that you don't just take a sleeping pill. Get to the root of the cause, and it may be something as simple as sugar. If I've said something in this video that helped you, give me a thumbs up. And if you haven't subscribed, subscribe to my channel and don't forget to hit the notifications. I'd love to have you, and I don't want you to miss my next video.